difference between osteoarthritis and rheumatoid arthritis? Anybody can tell the difference?
One is worse than the other.
You're absolutely right. We look at them as two distinct diseases, but in reality they're not. Osteoarthritis, or I should say rheumatoid arthritis, is a progressing disease of osteoarthritis. In other words, you've got a sick joint that got sicker and continues to get sicker and sicker. And for a long time they were distinct, but as we have more and more autoimmune diseases, as we have more and more severe diseases, that everything seems to be escalating, doesn't it? And this is no different in this round. The question that we have to ask ourselves is, first of all, why? Why do you have it in the first place? Why is it progressing to an autoimmune stage? Why is it getting sicker? You can have people that are hard on their bodies. A lot of people say, oh, I have it because I was hard on my body. But then there's people that have it that weren't hard on their bodies. So why is there a discrepancy? And what you need to look at is there's an underlying mechanism that has to happen. There's a series of things that add up to changing of environment that makes it, I don't know if hospitable is the right word, but sets the stage for it. So if you have this right combination, you can have it, but maybe if one of these elements are here, you don't have it, somebody else does. The other thing that tends to be a little bit blamed is genetics. And there is a genetic trend, there can be, but that genetic propensity doesn't mean you have to have it. So you may have it, you know, your parents may have it and your grandparents may have it, but we now know over the last 10 years through the field of epigenetics that we have the power to change our genetic expression. So in other words, just because your mother and your grandmother has it doesn't mean you have to. So what happened? What are the trends? What are the common denominators that was going on in your mother's and your grandmother's life that's now going on in yours too? And there's so many things that we have control of that we didn't think we did previously. Now, and I don't mean by control taking a drug and helping to control the symptom, but I'm talking about the expression so that it doesn't have to keep progressing.